If a person stops breathing, the person has only 4 to 5 minutes to be alive. And if you are to save that person, you have to be extremely fast. Hi guys, I am your private nurse, and in today's video, I am going to be showing you how to do mouth-to-mouth respiration. And I will also be telling you some of the causes that can make a person stop breathing. One of the causes why a person can actually stop breathing is a heart attack. Heart attack usually stops breathing. The second reason is when somebody is choking, when somebody is drowning, or when there is something that has blocked the airway. Another reason why somebody may actually stop breathing is if the person is unconscious and mucus or the tongue has obstructed the airway. So I will give you step by step, showing you how you can do mouth-to-mouth respiration and help somebody that is breathless within 4 to 5 minutes. So this is just a little disclaimer. If you want to be a professional in this, go to a basic life support program or an advanced life support program. This is just basic first aid for you to quickly do before the person gets up or before you are able to rush the person into the hospital. The very first step in this mouth-to-mouth breathing or respiration is to take the person, open their mouth, try to check if there is anything blocking the throat. Check if there is anything in the mouth or if there is anything in the throat, and try to remove anything in the mouth or throat. Gently bring out the tongue of that person outward. So the second step in this mouth-to-mouth respiration is to lay the person on a firm surface. Then, with your hand on the jaw and on the head, you are going to tilt the neck backward. Just tilt the head backward. When you tilt the head backward, you pull the jaw forward. Just like this. Pull it forward. The third step is to pinch the nose closely with the mouth wide open. Put your mouth to cover the person's mouth. Put your mouth to cover the person's mouth. Breathe very well so that it will go into the person's lungs and so that the chest rises. Okay. While doing this, while breathing in, you are going to pause to let the air come out of the person before you blow another air again. Okay, you are supposed to do this 15 times per minute. Repeat this 15 times per minute for an adult. For a baby, you should breathe very gently. Breathe 25 breaths per minute. 25 per minute for a newborn, 15 per minute for an adult, and it should be deep so that the chest can rise up and down. You keep repeating this until the person is able to breathe. You will continue doing this until the person is able to breathe by themselves, or maybe you find out that there is no doubt that the person is dead. Sometimes you would have to do this for an hour or even more than an hour. Okay? Many times people wouldn't want to use their mouth. Okay? This equipment can also be used in a case where you do not want to use your mouth. So you are going to use this. You will place it, when you open the mouth, you place it on the mouth. And then you breathe very hard, breathe deeply so that the person's chest can rise. Okay, so I'm going to come again. I said the first thing you do is you take the person, open their mouth, Check if there is anything inside the mouth that is obstructing it. If there is something, try as much as you can to remove it. Pull the tongue gently outward. Okay. Then the second thing to do is to place the person on a firm surface. When you place them on a firm surface, with your hand on the jaw and on the head, you are going to tilt the head backward. When you tilt the head backward, you bring the jaw forward. Okay? You bring the jaw forward. When you bring the jaw forward, you cover the person's mouth with your own mouth. When the person's mouth is covered with your own mouth, you begin to breathe deeply, like breathe very well. And when you breathe, you allow the breath to come back before you can breathe again. You are going to do it 15 times per minute, and for a newborn, you would gently do it. Gently do it for a newborn 25 times per minute. Okay, this is just a simple basic thing to do when you find yourself in such a situation, or you are not in the hospital where facilities can be placed for the person. I hope this video helps you. I hope it helps you. I hope you understood everything I just said. So thank you so much for watching. Make sure to like and then subscribe to the channel. See you all in my next video. Bye guys.